Cancer is scary, and it can be even more scary if you're not feeling well at home in the evening or on a weekend and unsure what to do. Did you know that your cancer center is open 7 days a week? They're not only open during weekdays, but also offer weeknight and weekend appointments. Your cancer center also has nurses and oncologists available by phone when the office is closed to answer your questions and decide if you need to seek care when you're not feeling well.
Hi, Pat, it's Jill. I understand you're not feeling well today.
Yeah, hi, Jill. Well, I thought it was time to call the clinic and speak to a nurse. I just was very nauseous all last night.
Oh, I'm sorry to hear that, but I'm glad you called us. Give me just a second. I'm going to open the chart in our triage system.
When a patient calls their cancer center, a process called triaging begins to rule out a potential medical emergency. Your information is electronically documented quickly for the assessment, similar to what you experience during an office visit with your doctor. The triage nurse will determine the severity of your symptoms and the best route of care.
So let's see. Tell me, you've been having nausea, you said, throughout last night? Is that right?
Yes, that's correct. All last night I was very nauseous.
Depending on your symptom or symptoms, the nurse will either ask you to come in to see your physician or give you instructions for care at home. If you are well enough to stay at home, they will call you back in a day or two to check on you. And you can always call back if you feel your condition has changed.
You know, I'm going to look in our schedule to see where I have an opening. I'd like you to come in and be seen. I'm scheduling you to be seen with Dr. Smith. I have an appointment time at 10 a.m.
Okay, thank you so much, Jill. I so appreciate your being able to fit me in today.
Isn't that better than going to the emergency room and waiting for hours on end without any idea of whether or not you'll see a doctor? That's just one of the many benefits of your local cancer center and the Come Home program.
An oncology medical home is a cancer center that's designed to keep you healthier so that you can spend more of your time at home and not have to be in a hospital. Our doctors and teams of nurses are focused on treating any problems you have early before you are too sick to stay home. We will direct you to the best place to get care when you need it, usually at your cancer center, on the same day or in the evening or on weekends. No waiting. So call us before you go anywhere else for care, and we will see you in the cancer center where your doctors and your nurses know your disease, your treatment, and you. We want to keep you healthier, avoid the complications of the hospital, and the copay is a lot lower for better care.
To learn more about the Come Home program, visit us online at comehomeprogram.com.